Hello friends, I am Dr. Pranamee. I am working as a consultant ophthalmologist in the GNRC 6 Mile unit. Today I am going to talk about the most important topic of eye, that is the cataract. So we know that cataract is in simple terms, it is the cloudiness of the lens, but it is a medical condition in which the transparent lens undergoes progressive opaqueness, and it results in diminished or blurry vision. So it is one of the most common cause of avoidable blindness in the whole world, and according to the NPCB guidelines, there are still 22 million backlogs of cataract, of blindness, and 80.1% of those blindness account for the cataract. So it is called avoidable because we can avoid it by simply getting the treatment at proper time. Now cataract can occur in one or both the eyes, but not at the same time. But it does not spread from one eye to the other, so it is very much non-communicable. But the progression of the cataract is different in each eye. Okay, so one eye may be worse than the other eye. So now we are coming to the causes of the cataract. So there are so many causes. One is the congenital, infantile, but the most common cause is the age-related cataract. So age-related cataract is very much gradual in onset, it is slowly progressive, and it is painless. So the person once the person reaches 55 years of age, he tries to see the objects with very effort. So he comes to us and then we examine the person. But after that, after this cataract, the most common is a traumatic cataract. Anywhere the patient, if has got a blunt trauma in the head or the eye, so he may have the cataract very early. And the third most common cause is the metabolic, and metabolic cause in it we have got the diabetic cataract. That is the most common nowadays, because each and every person whose blood sugar level goes above 200, then the diabetic cataract starts to develop. So these are the most common causes of cataract. Now we are coming to the sign and symptoms of the cataract. The person comes to us in the OPD, they complains of the diminution of distant vision. Sometimes they complain that there is some blurriness or cloudiness of the vision. The next common cause is that some old person, they come and tell us that there is improvement of the near vision. So they can see without spectacles, but near work, or they like reading or writing. But this is one of the symptoms of cataract only. Thirdly, there will be fading of the colors. So colors will not be so much appropriate, it will be faded. And then there will be like it will be so much diminution of vision it will be so much so that one cannot carry out his or her routine activity. And second one is that the person will find it difficult to walk at night, or if he is driving, that night driving will be very difficult. And too much bright light, if it falls upon your eyes, then for 1 or 2 seconds there will be like blackout of vision. So these are the few symptoms with which the patient comes to us. Now lastly, I want to talk about the prevention of the cataract, which is the most important part. And we can carry out with, number one, we have to wear dark goggles during daytime to prevent the ultraviolet rays from the sunlight. Now the second thing, we have to stop quitting the smoking or alcoholism. It should be stopped so that we can arrest the progression of the cataract. And thirdly, when the cataract is very mild, we can manage it by giving proper spectacles. But if the cataract is very severe or like very hard, then we have to go for a definitive treatment, that is the cataract surgery. So in this surgery, what we do is that we exchange the cataractous lens, and we give, instead of it, we give an artificial intraocular lens. So with this, if the patient has got a good retina and good corneal epithelium, then he can see the whole world once again. So that is like giving doing a magic and giving the person the vision he was wanting it for. And the second most important thing is that after the cataract surgery, we used to guide the patient wearing the dark goggles and what are the different hygiene hygiene and care which he has to do, and also the eye drops which we have to instill. That will be all discussed after the cataract surgery is over. But the main thing is that the person need to come to us to have their eye examinations, and if they want to know what is the status of the cataract. And lastly, if the cataract is left untreated, some of us or many of the persons coming from rural areas, they used to neglect it. If you make this cataract neglected, then this cataract will go on increasing in size, and after some time there will be like impairment of the vision, visual loss, and lastly it will end up to total blindness. And this is the thing which we have to keep in mind, and please come to us for cataract screening so that we can carry out the proper examination and guide you accordingly. So I hope you will find this video very useful, and make our public or our near ones, relatives, aware of what is cataract, and it is very much preventable by using very cost-effective daycare procedures. Cataract surgery is very much daycare, it is very painless, and the patient can be discharged on the same day.